In a terrain even rugged for able-bodied people, a child with a disability is severely disadvantaged, all the more in a country of mostly small farmers, where each household needs every hand for the family to sustain itself. 8-year-old Pragya was such a child. She was born with clubfoot, which is a condition of both feet growing inwardly. Fortunately, Pragya underwent an operation to correct her disability 3 years ago. Her benefactor was the Hospital and Rehabilitation Center for Disabled Children in Banapa, 25 kilometers east of Kathmandu, the country's capital. Over the years, HRDC, as the hospital is called, has provided reconstructive surgery and rehabilitation for more than 10,000 children who come with a broad range of physical disabilities from all over Nepal. Five-year-old Saroj contracted polio as an infant. He and his mother walked for 3 days to reach a roadhead to catch a bus to the hospital.
यो पनि हेर्नुस् त यो पनि अलिकति चाहिँ नि यो छ नि यो कडा भइसकेको छ अहिले डरो भइसकेको छ सानोमा चाहिँ बच्चा उ चाहिँ एक हप्ता 2 हप्ताको बेलामा चाहिँ यहाँ ल्याएको भए यो चाहिँ नि तपाईको बिस्तारै तन्काएर हैन प्लास्टर गरेर स्प्लिन्ट्सहरु लाएर यो चाहिँ नि राम्ररी यो चाहिँ नि सोझो हुन्थ्यो.
1/3 of all children who come to HRDC have congenital disabilities, such as clubfoot. Like 2-year-old Shanti Lama from Kathmandu. Shanti was operated shortly after her admission to the hospital. Fortunately for her, clubfoot operations have become routine for HRDC's skilled surgeons. This mother was also late in bringing her infant to the hospital. If he had been brought in time, his clubfoot could have been corrected without surgery. Often children and their guardians have to stay weeks or months at the hospital. During this time, both parent and child are taught to do physiotherapy, as recovery depends very much on the patient continuing the regime long after they leave the hospital. Little Manju had an operation for clubfoot 3 months ago. She is being fitted with these special shoes to keep the foot in the right position. The orthopedic workshop at HRDC produces its own custom-made appliances for patients. To reduce cost, local material is used wherever possible. Here, a sewage pipe is being turned into a device that is worn to keep the foot in a correct position after surgery. In all, HRDC produces more than 130 new appliances every month. The driving force behind HRDC is Nepal's leading orthopedic surgeon, Dr. Ashok Banskota. He began the clinic in 1985 with a skeletal staff and support from the Swiss charity Terre. He was the only doctor then. Today, HRDC has 120 staff who care for more than 5,000 patients per year.
The Hospital and Rehabilitation Center for Disabled Children is the only hospital of its kind in Nepal, and I would say that there are very few hospitals, probably even in the South Asian continent, that are built in this context where there is a very intensive in-hospital based team that is able to deal with a wide spectrum of physical disability problems, and the care extends from the hospital setting into the home environment. Because of lack of adequate healthcare facilities, because of lack of education, because of socio-economics, because of the geographical terrain of Nepal, and all these things put together, a lot of people with simple problems are not able to have access to proper care right away. We are dealing with a lot of mundane problems that cause serious complications still.
9-year-old Rita Nepali was playing alone at home when she fell into the open kitchen fire. There were no functioning health facilities nearby, so the wound was not properly treated. It was much later that her father found out about HRDC. Every 10th child who comes to the hospital is afflicted with post-burn deformities.